Have you ever seen what an arthritic knee looks like? Well, here is a real human knee with multiple degenerative changes, the primary one being osteoarthritis. So today, I'm going to show you what's wrong with this knee, while showing you many of the cool ligaments like the ACL, the MCL, and even what's left of each meniscus. We'll also talk about what causes knee degeneration and this type of pain, and more importantly, what you can do to prevent and treat it. It's going to be a neat one. So, let's do this. So let's orient you to this knee so you know exactly what you're looking at. So here we have a right knee, and why I know it's a right knee is because I've got the kneecap here, or the patella, which means this is the front or the anterior aspect of the knee. If I reflect that out of the way, you can see me tapping the femur with my thumb, so that's where the thigh would be. And then we've got the bones of the lower leg. We've got the tibia in the fibula. Now there may have been times where I've been a little obnoxious with some of my students, because sometimes when they're first learning these bones, they might say tibia and fibia, and I'm like, no, it's tibia and fibula, la, because the la in fibula helps to remind you that it's the lateral bone, and that's probably how the mom in Schitt's Creek would pronounce lateral.
Okay, well this coffee has nothing in it.
Oh, it's just a gesture, David. Stop being so literal.
But either way, because we know that the fibula is the lateral bone, we can bring it over to Jeffrey, and if I put it on the left side, you can see how that wouldn't work because that fibula is on the inside. But if I move it over to the right, I've got the fibula where it needs to be, the kneecap where it needs to be. You can see how that would compare to Jeffrey. So we've got this right knee. But as a fun little FYI, did you notice what bone Jeffrey is missing in his knee? If you do, go ahead and put it in the comments. But let's take a look at some of the cool ligaments on this knee. The first ligament that we'll take a look at is the medial collateral ligament, also known as the MCL. If I can get my probe underneath there, you can see how broad and flat this ligament is. Now, this ligament is one of the more commonly injured ligaments in the knee, and it also forms an interesting relationship with the medial meniscus. Well, what's left of this particular medial meniscus, and I'll get into that in just a second. But the upper portion of this MCL will actually attach to that medial meniscus. So if you were to tear or damage the medial collateral ligament, or that MCL up here, that could simultaneously tear or damage the medial meniscus as well. But let's move over to the lateral side of the knee. We've got another ligament called the LCL, or the lateral collateral ligament. And you can see me tracing that with the probe there. Now if we go inside, we've got some other commonly known ligaments that you've probably heard about. The one that you've probably heard the least about actually between the two in here is the PCL. Let me probe it and then I'll show you up close on the camera there. So right at the tip of the probe is the PCL, and that's actually jutting backwards like so. And PCL stands for posterior cruciate ligament, cruciate referring to crucifix, because this is going to form a cross with the very commonly known ligament known as the ACL. Now let me show you the ACL here. So right at the tip of the probe is the ACL, and you can see that going backwards and upwards there. And that ACL, again, is a very commonly torn ligament that you hear about with people, often with sports injuries. Now, in a typical anatomy class, you'll often hear ligaments connect bone to bone, and that is absolutely true. But I do feel like we could go a little bit further and give ligaments a little bit more credit. I will tell my students, yes, ligaments connect bone to bone, but they also define the range of motion of a joint. And what do I mean by that? Well, let me give you an example here, and hopefully I don't tear my own ligament by getting on a rotating chair here. I'm going to try to be a ninja here. Okay, so what I mean by the ligaments define the range of motion of a joint, we learned 4 ligaments there, and essentially the ligaments of the knee say you can go into flexion, extension, so move this way and this way, and a little bit of rotation. Whoops, as I rotate the chair, and don't die there. So what I mean by this is, like, let's say the MCL we've got here. That would prevent the lower leg from moving outward or going into abduction, or what somebody might say is prevents like a valgus strain. If something pushed far enough on the outside of your knee and pushed it inward, that could potentially tear your MCL. The LCL prevents your lower leg from going inward or like adduction, or if somebody were to put like a varus strain, which would be pushing outward, that could tear the LCL. The ACL prevents your lower leg from sliding forward and hyperextending, where the PCL prevents your lower leg from sliding posteriorly or backwards. And so essentially that's what we mean by define the range of motion of a joint. Those ligaments keep that joint stable, define its movements, and again, if you push too far one way or the other, that could tear some of those ligaments. So finally, let's take a look at what's wrong with this knee. This knee has major degenerative changes, mainly on the articular cartilage. So if we look inside here, we can see this cartilage is rough looking, not smooth, not uniform, and just blah. I guess blah is our technical term for degenerating cartilage. But when we have degenerative cartilage in the joint like this, we call it osteoarthritis. Now, the nicest piece of cartilage we probably have on this knee is right here. You can see it's more glossy, smooth, and uniform. And if we had a healthy knee, just imagine this type of cartilage being more uniform up on both condyles of the femur and in between on that groove. Now, I do have a knee that has a little bit less arthritis, and so if we go over here, here's another right knee. Up here you can see the cartilage is a little bit better, smoother, I should say, more uniform. But as we move down on the condyles, you can also see on this knee, it thins out and gets a little bit more arthritic. Not nearly as bad, again, as this knee. And let me see if you can actually hear this. So try to listen closely here. I'll tap right here. So we got some cartilage there. But if I tap over here, pretty much all the way down on bone right there. So severe arthritis in this knee. Now, arthritis may not only just affect the articular cartilage, it can also affect those fibrocartilage pads that we call the menisci. Menisci is just plural for meniscus. We have a medial meniscus and a lateral meniscus in the knee. But on this particular knee with severe arthritis, the meniscus is pretty much completely gone with the exception of the outer rim of it. So let me see if I can touch that for you so you can see it closely. Right there, just that outer little rim is what's left of the meniscus here, and even a little bit on the front. And if I put a picture up, you can see what a normal meniscus should actually look like, but we just have that edge or that rim left. Now, the meniscus on this knee, or the menisci, aren't much better here. You can actually see, here's the medial meniscus on this particular knee. And I actually can slide it off the medial condyle of the tibia here. Watch this, sliding off right there. So some wear and tear on this meniscus as well. And the menisci are extremely important for shock absorption for the knee and actually proper tracking of the knee.